All right, Jeff, thank you. Well, going out of business tonight. That's what workers at several local independent pharmacies say could happen if pharmacy benefit managers, PBMs, aren't regulated more. Lawmakers put a House bill on the table, 9096, also known as the Pharmacists Fight Back Act in the House, a bill that they say aims to make the prescription drug system more fair. Wave 31 Weekend anchor Rob Sneed spoke with the director of pharmacy at Star Discount Pharmacy. Rob, he says lives could also be at risk.
He certainly did, Nikhil. He also said, too, because of pharmacy are closing and prices are rising, he says he hopes that this bill somehow will reverse some of the damage that's been done.
Prescription drug prices have gone up, and they have passed those prices along to the patients at the pharmacy counter.
Trent McLemore, the director of pharmacy at Star Discount Pharmacy, says pharmacy benefit managers, PBMs, are to blame. PBMs act as a middleman for insurance companies, and he says PBMs often direct profitable prescriptions to their own mail-order pharmacies, leaving independent pharmacies like his with less profitable prescriptions.
You may have two drugs like Ozempic and Mounjaro, two drugs used for diabetes and or weight loss. Very similar. How do you choose between those two? Well, it's whichever one the insurance covers, right? So the company that makes that one of those drugs is going to pay the PBM a rebate.
Trent says pharmacies or drug companies often pay PBMs a kickback of about 50% of the drug's cost to ensure that the drug is preferred on the PBM's drug list. And he and others say this practice has played a part in many pharmacies closing down. 300 of Alabama's 800 independent pharmacies closed down in the last 6 years, according to public records from the Alabama Pharmacy Association. It has also affected major chains like Walgreens, which plans to close down around 1,200 locations. To curb this, Representatives Jake Auchincloss, a Democrat from Massachusetts, and Diana Harshberger, a Republican from Tennessee, introduced the Pharmacists Fight Back Act, House Bill 9096. The bill's key goals include set fair payment rules for pharmacies, make drug pricing more transparent under government programs like Medicare and Medicaid, ensure consistent reimbursement for pharmacies across federal health plans. The bill is bipartisan and has 34 co-sponsors. Trent says he'd like to see that bill signed into law. Are lives at risk?
Absolutely. Yeah, absolutely. I mean, you know, the quality, at the end of the day, I can boil it down to this. PBMs, the pharmacies they own, they are beholden to their stockholders. We are beholden as independent pharmacies to the people across the counter.
And tonight I also reached out to the trade association that represents PBMs, the Pharmaceutical Care Management Association, and right now I'm still waiting to hear back from them. For now, I'm reporting live in Huntsville with coverage you can count on. Rob Sneed, Wave 31 News.
All right, Rob, thanks for that report. U.S. Representatives Dale Strong and Robert Aderholt are co-sponsors of this bill. We're still waiting to hear back from Strong, but Aderholt sent us a statement that reads, in part, quote, "I'm supporting this bill because these pharmacy benefit managers have increasingly put profits ahead of what's right. This is causing a burden to consumers, to locally owned pharmacies, and also playing a role in our ever-increasing national debt. This bipartisan bill will go a long way toward correcting all of these wrongs."